Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Ureter are also called as circumcaval ureter. In retrocaval ureter, there is an embryologically normal kidney. The embryologically normal kidney normal ureter gets entrapped behind the inferior vena cava. That is, this is an inferior vena cava. This is an inferior vena cava. Now the normal ureter which is there, this normal ureter will get like this. It is entrapped behind the inferior vena cava. That is, this inferior vena cava will compress the normal ureter. It will compress the normal ureter. So when the normal ureter is compressed, so as a result, this will result in hydronephrosis in the kidney in the patient. So why is this happening? This is because there is abnormal persistence of the right cardinal vein. There can be when there is abnormal persistence of the right cardinal vein. This will force the right ureter to encircle the vena cava from behind, or we can say that it is mainly because of altered development of inferior vena cava. So because of the altered development of inferior vena cava, there is retrocaval ureter is seen. Here in retrocaval ureter, the right ureter will be present behind the inferior vena cava. So it goes medially behind and it winds around and crosses it. So it is something like this. It crosses in front from the medial to the lateral side and resumes its normal course to the bladder. It's something like wounding around the ureter. So it can also be called as circumcaval ureter, or if I have to draw it in a better way, so this is the uh, this is the inferior vena cava. This is the right kidney. This is the ureter. The ureter first it deviates medially behind. It is medially because this is the midline. Okay, this is medially behind, and then after going medially again it goes in front from medial to the lateral, and then it resumes its course to reach the bladder. So this is how you see this. Okay, now this is also called as circumcaval ureter. It is more commonly seen in males than in females. Now, in the circumcaval ureter, the main clinical features are, because here the inferior vena cava is constricting or obstructing the ureter, the features of ureteric obstruction and hydronephrosis are seen in the patient. Number one. Number two, diagnosis. Diagnosis can be done by an MRI. If you do an MRI, you can see the anatomy very clearly, and this is definitely a non-invasive test. Then you can also so the investigation of choice is an MRI definitely, but we can also do intravenous pyelography. In intravenous pyelography, you will see presence of reverse J-shaped or fish hook or shepherd crook deformity of retrocaval ureter is seen on intravenous pyelogram. We can also do a retrograde ureterography can also be done in the patients. Surgical management. Surgical management is you should do the ureteral division, and then you can do the uretero-ureteric anastomosis. That is, if this is the ureter and this is the if this is the inferior vena cava, this is the ureter. Now you will have to cut the ureter here and again here, and you will anastomose these two parts together. So first you are doing a ureteral division and then you can anastomose these parts together, or you don't need to give this incision at all. With one incision this behind part is brought to the front and it can be anastomosed also. So this is relocation ureterostomy is done in most of the cases of obstruction.
thank you and thank you for watching.